In this video, we're going to discuss the signs and symptoms of depression, as well as provide an overview of available treatments and different signs to look for. We'll look into how to recognize these signs in yourself or others and determine when it's time to seek help. Depression is a really serious mental health condition that affects millions of people around the world. It's characterized by intense feelings of sadness, hopelessness, and worthlessness, as well as a loss of interest in activities that were once enjoyable. Depression can strike anyone, regardless of their age, gender, background, and it's important to recognize these signs and symptoms in order to get help. In this video, we're going to be discussing the common signs of depression, the different types of symptoms that can occur, and the treatments that are available for those who are suffering. Whether you are dealing with depression with yourself or you know someone who is, this video will provide valuable information and insight that can help you get the help you need. Signs and symptoms of depression. Signs and symptoms of depression can vary from person to person, but in general, they may include feelings of sadness or hopelessness, loss of interest in activities that were once enjoyed, fatigue, irritability, difficulty concentrating, changes in appetite or sleep patterns, persistent physical symptoms such as headaches or stomach aches that don't seem to have an apparent cause, and thoughts of death or suicide. It's important to understand that these symptoms may not always be present, and not all of them have to be present in order for depression to be the presenting mental health concern. And some of these symptoms can actually come and go over time. It's important to note that depression can manifest differently in each individual. However, when we see symptoms such as the emptiness, guilt, and worthlessness, we're usually looking at something around depression. It's common for those with depression to experience changes in appetite and either overeating or not eating enough. They also may experience physical symptoms like we discussed, such as headaches or stomach pains or general aches and pains of the body. Depression can also affect cognitive abilities and make it difficult for individuals to concentrate or make decisions. It can lead to negative or self-deprecating thoughts that are difficult to shake off. And in really severe cases, depression can lead to thoughts of suicide, which is why it's crucial for loved ones to be vigilant for warning signs and seek professional help immediately if you're concerned about someone you know. It's important to keep in mind that depression is a medical condition that requires treatment. If you or someone you know is experiencing any of these symptoms, it's important to seek help from a mental health professional. With proper diagnosis and treatment, depression can be managed and individuals can regain a sense of normalcy in their lives. Physical symptoms of depression. Depression can manifest itself in many ways, both physical and psychological. However, our common physical symptoms to watch for include fatigue, insomnia, oversleeping, changes in appetite, weight gain or weight loss, and aches and pains. These symptoms may be the result of underlying depression or can also be a side effect of antidepressant medications if the individual is prescribed these. Tracking the physical symptoms of depression is important to understand which symptoms are from the depression and which symptoms might be causing depression. Emotional symptoms of depression. Emotional symptoms of depression can include feelings of sadness or hopelessness, guilt, worthlessness, or difficulty concentrating. People often will experience changes in self-esteem, lack of motivation, and pleasure in activities. Beyond the physical symptoms, these emotional and psychological effects also can be debilitating for people suffering from depression. Possible causes. Depression is a complex disorder that can have many causes, and these can range from genetics to physical ailments to life circumstances. It's important to speak to a qualified doctor or psychologist in order to determine the underlying cause of depression and the best course of treatment. Treatment options for depression. Fortunately, there are many treatment options available for those suffering from depression. These include psychotherapy, medication, lifestyle changes such as diet or exercise, and alternative therapies like acupuncture or massage. Working with a mental health professional can help you determine which treatments are best for you and how you manage your symptoms. Depression is treatable. The two most common treatment methods you'll come across are going to be medication and therapy, or usually a combination of both. Antidepressant medications are typically used to improve symptoms for moderate or severe depression. They can help you balance chemicals in the brain that influence moods and emotions. Whilst you take antidepressant medication, usually you are advised to seek therapy, which is another highly effective treatment for depression. Talking to a mental health professional allows for the exploration of emotions and problem solving in a safe and supportive environment. Types of therapy include cognitive behavioral therapy, dialectical behavior therapy, interpersonal therapy, and psychodynamic therapy. Cognitive behavior therapy, or CBT, is a type of psychotherapy that focuses on identifying, understanding, and changing negative thoughts and behaviors. It's based on the idea that our thoughts and beliefs about ourselves, others, and the world around us often can be inaccurate or unhelpful. CBT helps people become aware of these inaccurate thought patterns so that they can make positive changes in their behavior and outlook. CBT has been proven effective in treating depression, anxiety, phobias, OCD or obsessive compulsive disorder, eating disorders, PTSD or post-traumatic stress disorder, substance abuse issues, relationship problems, and more. Interpersonal theory is a form of psychotherapy that focuses on relationships between people and how they can impact one's mental health. It helps individuals identify patterns in their interactions with others, as well as any unhealthy behaviors or thought patterns that may be contributing to depression or other psychological issues. IPT also looks at current life events and how these have been affected on the individual's mood and behavior. Through this type of therapy, individuals can learn new ways to cope with stresses and develop healthier relationships with those around them in order to improve overall mental health. Dialectical behavior therapy, or DBT, is a type of cognitive behavioral therapy that was originally developed by psychologist Marsha Linehan to help people with borderline personality disorder. DBT has since been adapted and used to treat other mental health conditions such as depression, anxiety, post-traumatic stress disorder, substance use disorders, eating disorders, and suicidal ideation. The goal of DBT is to help individuals learn how to regulate their emotions in order to lead healthier lives. This can be done through the four main components of the treatment: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness skills. By focusing on these areas, individuals are better able to manage difficult situations without reporting self-destructive behaviors or thoughts. Psychodynamic theory and therapy is another type that's also used to treat depression. Its focus is on exploring unconscious behavior patterns and past experiences that may be contributing to current symptoms. The therapist works with the individual to identify and understand unresolved conflicts or emotions from childhood or past relationships. PTD emphasizes the importance of the therapeutic relationship, as it proves a safe space for the individual to explore their emotions and work towards resolving underlying issues. This type of therapy can be particularly helpful for those who have experienced trauma or who have a history of attachment issues. Through the exploration of these past experiences and emotions, individuals can develop a greater understanding of themselves and work towards creating a more fulfilling present and future. Lifestyle changes may also be used to help manage depression. Things like regular exercise and a healthy diet, along with sufficient sleep, can help alleviate symptoms. Avoiding alcohol and drugs may also be of benefit to those suffering from depression. When to seek help. If you or someone you know is experiencing any symptoms of depression, it's important to seek help from healthcare professionals. Depression can worsen over time and can lead to serious consequences, including suicidal thoughts or actions. Treatment for depression, whether through medication, therapy, or lifestyle changes, can reduce the severity and improve the quality of life for those with depression. In summary, recognizing the signs and symptoms of depression is important to seeking treatment. Physical and psychological symptoms can manifest, and medication, therapy, or lifestyle changes can decrease the severity of the condition. Seek help if depression is suspected in order to prevent worsening and adverse consequences. Thank you so much for watching. If you or someone you know is struggling with depression, please reach out for help. Resources are available and there is hope for a brighter tomorrow. Emergency lines are linked in our comments below for Australia, and please reach out to your local suicide hotline if you're international and you need support. Thanks for watching.